Hello, I'm Matthew Koffenberg, physical therapist and owner of Perham Physical Therapy. You know, my friends and family and patients often ask me, what do you see the most in your clinic? What do you deal with the most in your clinic? And it's hands down, I work with low back pain the most. So as I was preparing for this TV3 taping, it really dawned on me that I need to spend some time talking a lot about low back pain, because low back pain affects pretty much everybody. Most people at some point in their life are going to have an episode or two of low back pain. And actually research suggests that most people, 60 to 75% of us, will actually have multiple episodes of low back pain at some point in our life. So I really wanted to spend some time diving deep into this low back pain issue, and more of my focus actually was I wanted to show you how you can manage your low back pain, how you can control it at home and not necessarily be dependent upon medication or doctors or even physical therapists. I want you to be able to control this at home. So there's a really good program out there developed by a physical therapist. His name was Robin McKenzie. He was from New Zealand, and he developed this program back in the 70s and 80s, and it's still being used a lot today, and it's helped thousands of people. It's a program that if you truly qualify for the program, 90% of you will actually see some benefit from utilizing the information that we'll talk about. Now, this isn't something I can talk about in one episode, so this likely will take 3 to 4 episodes, but we're going to build upon each one of them. We're going to talk about some myths associated with back pain. We're going to talk about, do you truly qualify for this particular program? So let's just jump in. We're going to first talk about what really causes back pain. Most people who have back pain have what's called mechanical back pain. What that means is the back pain is from the moving parts. So when we say there's mechanical pain, we mean that pain is from the moving parts of our body. So in the back, we're talking about the vertebra, we're talking about the discs, we're talking about the muscles, we're talking about the ligaments. So those areas that help produce and help guide movement typically are what are causing the pain. There are instances where you can have inflammation that is causing the pain. There are instances that are truly what we would call catastrophic, like some cancers can sometimes cause some low back pain. But 90% of the time, most of our low back pain is mechanical in nature. And what's nice about this program that we're going to talk about today is that you at home can really determine, is this truly mechanical, or is this something that I really need to go and see a doctor for? So let's first talk a little bit more about mechanical pain. Mechanical pain is characterized by pain with movement or pain with sustained postures. So if you're someone who has pain after you've been sitting for 30 minutes or you've been in the car for 45 minutes and now your back is starting to hurt, that is called mechanical pain. Or if you're somebody who has pain when you're out swinging a golf club, that's called mechanical pain. Mechanical pain oftentimes is better when we actually are moving versus when we are stationary. And a lot of times mechanical pain is characterized by intensity shifts, meaning part of your day you have no pain and part of your day you do have some pain. We'll conclude this episode today by trying to dispel some myths associated with back pain. Myth number 1 is that acute back pain is short-term pain. That's actually a myth. What I mean by that is, what I said earlier was that 60 to 75% of us will have multiple episodes of back pain. So it isn't just a one-time deal where you get back pain, you get treated, and it'll never come back. Typically, this becomes chronic. Typically, you have back pain once, and then it'll come back. So it's really, really important that we have a good program in place for you to deal with this on your own. Myth number 2, spinal manipulations are the best treatment for low back pain. Spinal manipulation is great. It really does reduce pain. However, it's not the best treatment for low back pain. The best treatment is education, and the best treatment is a program that you can do at home. Myth number 3, passive therapies accelerate the healing. Passive therapies are like ultrasound and electrical stimulation. They don't accelerate healing. They do work, by reducing pain, but they really do not accelerate that healing process. Passive therapies, well, actually, our bodies know how to heal themselves. We just need to not get in the way. Myth number 4, back pain is caused by inflammation. Not true. Back pain is typically caused by movements. Myth number 5, back pain is caused by arthritis. If I took 10 people who were over 70 years of age and I x-rayed them, all 10 of them would have some arthritic change in their spine. Doesn't mean they have pain as a result of that. Myth number 6, you should take it easy and avoid exercise. Myth number 7, you should stop all activity. Those are both myths. Motion is lotion when it comes to the back. You really need to keep moving to keep the back healthy. And myth number 8, back pain is caused by the weather. It is true that barometric pressure does affect our pain, but it doesn't cause our pain. Next time we'll talk about, do you truly qualify for the program that we're going to discuss? Thank you very much. I'm Matt Koffenberg, physical therapist, owner of Perham Physical Therapy. If you have any questions, give me a call, 218-346-2464.
Thank you for watching Wellness for Life.